Wait, you mean to tell me that the disease of obesity is linked to over 200 medical conditions? Well, let's discuss it. Hi, I'm Dr. Jeremy Briner, bariatric and foregut surgeon, and I specialize in both medical and surgical obesity management. And I think it's important for patients to empower themselves with the knowledge of these medical conditions related to obesity. So I'm going to attempt to name as many as I can in this video. And go. Metabolic syndrome, prediabetes, type 2 diabetes, hypertension, hypercholesterolemia, coronary artery disease, heart attacks, heart failure, cardiomyopathy, cardiac arrhythmias, AFib, stroke, DVTs, PEs, obstructive sleep apnea, obesity, hypoventilation syndrome, asthma, bronchitis, pneumonia, pulmonary hypertension, breast cancer, endometrial cancer, ovarian cancer, esophageal cancer, gastric cancer, liver cancer, colorectal cancer, renal cancer, pancreatic cancer, multiple myeloma, meningioma, gallbladder cancer, thyroid cancer, osteoarthritis, chronic back, knee, or hip pain, degenerative disc disease, herniated discs, spinal stenosis, sciatica, bone fractures, flat feet, bunions, slipped capital femoral epiphysis, Blount's disease, rickets, carpal tunnel syndrome, gout, immobility, need for cane, walker, or wheelchairs, fatty liver disease, cirrhosis, portal hypertension, pancreatitis, gallstones, gastroparesis, GERD or heartburn, LPR, bile reflux, Barrett's esophagus, hiatal hernias, inguinal hernias, umbilical hernias, ventral hernias, chronic kidney disease, renal failure, dementia, Alzheimer's, ALS, and Parkinson's, peripheral vascular disease, venous insufficiency, lymphedema, lipedema, autoimmune diseases, multiple sclerosis, rheumatoid arthritis, psoriasis, inflammatory bowel disease, Crohn's, UC, lupus, type 1 diabetes, myasthenia gravis, scoliosis, hyperparathyroidism, Hashimoto's thyroiditis, sinus infections, ear infections, retinopathy, cataracts, macular degeneration, glaucoma, dry eye disease, floppy eyelid syndrome, gum disease, cavities, tooth loss, idiopathic intracranial hypertension, pseudotumor cerebri, headaches, migraines, anxiety, depression, skin infections, bacterial infections, fungal infection, eczema, psoriasis, acne, paniculitis, pressure sores, hidradenitis, pilonidal cysts, irregular menstrual cycles, PCOS, endometriosis, ovulatory dysfunction, increased risk of miscarriage, infertility, endometrial hyperplasia, fibromyalgia, complex regional pain syndrome, pelvic floor dysfunction, bladder prolapse, uterine prolapse, rectal prolapse, erectile dysfunction, low testosterone, decreased swimmer count, vitamin deficiencies such as A, D, E, K, and C, as well as folate, thiamine, B12, micronutrient deficiencies such as zinc, copper, selenium, as well as calcium, magnesium, potassium, anemia, increased complications from injury, trauma, surgery. Okay, this isn't even all of them, but I'd say we did it. Remember, your weight is not your worth. But we know that if you are able to lower your BMI out of the obese range, all of these conditions can greatly improve or even resolve. And this is why I'm passionate about obesity management. So let me know, were there any on this list that you were surprised to hear about? And if you have any questions about weight loss medications or bariatric surgery, leave them below and I'll be happy to answer them.